Welcome to Community Conversations. I'm your host, Fremont Unified School District Superintendent Jim Morris, and I welcome you to another year featuring our district's students, staff, and programs. We start the new school year with an important initiative we're expecting to bring to our community this year. September is Attendance Awareness Month, and FUSD has partnered with several great organizations to promote the importance of school attendance through the Everyday Counts program. Banners, posters have been posted at schools, city facilities, and bus shelters throughout Fremont to remind families of the short and long-term benefits of being in school every day. Here with us to discuss the program are FUSD Student Support Services Coordinator, Dr. Denny Marenko, Health Services Coordinator, Cheryl Knight, and Child Welfare and Attendance Specialist, Danielle Finneman. It really is a pleasure to welcome you and talk about this important topic, really sending a message to the community. Every day counts. Can you begin by just talking a little bit about what is Everyday Counts and why is it so important for our students?
So Dr. Morris, Everyday Counts is a collaborative effort between the City of Fremont, Fremont Police Department, and Fremont Unified School District to ensure every student in school on time every day. And we've been basing our work off of attendance data.
So what would you say is what's the goal of this? Why is this so important to us as a school district and to the community?
Well, we as a district, we're proud of the average daily attendance that we receive here in Fremont. Compared to other districts in Alameda County, Fremont Unified School District really does have a large and high average daily attendance. That said, there are still in excess of 1,500 students who are chronically absent in our district, and we want to be able to provide targeted support, not just at the district office level, but also with support and professional development and coaching at the school sites to ensure that these school communities are also working with us to ensure that students who are chronically absent are also understanding the value of coming to school on a daily basis.
So Danielle, you mentioned earlier, and it kind of ties into this idea, this is a collaborative effort. The City of Fremont, the school district, and the Fremont Police Department. Why is school attendance important to the city and to the police department? Why have they come along our side as partners in this effort?
You know, sir, I neglected to mention that we're also partnering with Tri-City Health Center. And when you, I think that collaboratively we're looking at it as a measure of school health. When students are present, this shows that your program is healthy and children are there ready to learn, be a part of the community, receive mentoring.
We talked a little bit about the problem of truancy, of students who are not in school when they're supposed to be. How big of a problem? You said 1,500 students. How does that compare with the rest of California or nationally, this idea of student absence from school?
It's a great question. So when you look at locally, in Alameda County, the truancy rate is approximately 21%. So compared to Alameda County, again, Fremont Unified School District is doing quite well. And then within the state of California, 8% of students, or approximately 230,000 students, are missing 18 days or more within the school year. And 18 days is usually the threshold at which a student would be categorized as chronically absent. And chronically absent is defined as the number of absences that have been missing due to excused or unexcused reasons.
So you throw out these terms, and I just want to have you define them a little bit to make sure that parents or community members who are watching this, what's the difference between chronically absent and truant? I'm thinking back, right, to the good old days, and if you were absent from school and the truant officer came and knocked on your door and picked you up by the scruff of your neck and dragged you to school, there's this concept of truancy, it's really a bad thing. What's truancy versus chronic absence?
Right. So our philosophy is any day missed school, every day counts. So we do understand that there are illnesses and there are various other reasons or barriers that are preventing families from attending school. And we as a group, as a district office, and as a school attendance review board panel, we want to understand. We want to be able to problem solve those critical issues that are preventing school attendance from happening on a regular basis. That said, when a student is truant, that means that a student on a third absence receives a truancy letter, basically stating that the student has been absent without an excused reason for 30 or more minutes for a third day. And that generates a truancy letter in our school district. As the number of truancy letters, as the truancy increases, so does the number of truancy letters to a second, a third, and a fourth. And in between that time, we work with school sites, and school sites also implement various interventions to help assist parents in problem solving those truancy cases.
So if a parent, just to be clear, has a child, for example, and the child has chickenpox, they're absent from school for a week, is that considered truant because they're absent 5 days?
In that case, it would not, because that is a verified illness. Now, when families call schools to say that they are ill, that qualifies under California Education Code as a verified absence. It's when you have absences that are not validated or not categorized as a verified absence per California Education Code that families would begin to receive truancy letters.
So our message to families is, if your child is legitimately ill, we don't want you to bring them to school and make everybody else sick. We want you to keep them home and take care of their medical needs. As a medical professional, Ms. Knight, what would you say, how would you guide a parent to know when to keep them home? Well, they have sniffles a little bit. Do I keep them home then? When do I send them to school?
That's a good question, and Alameda County has some guidelines that we utilize here in Fremont, and that information is on our website, and it actually goes out to families when they enroll through the district. So there's some very clean criteria that Alameda County sets up to tell families when they can send kids to school and when they shouldn't send kids to school. We want to make sure that they're not infectious because we don't want to expose any other students to an infectious disease. So, you know, we want to make sure that they're very clear on that. The office staff are aware of what that information is, and the school nurses out at the school sites also can talk to families and provide them with that information. So we try to make that very simple for them. So sometimes, you know, kids may not be feeling all that great, but they still can come to school and perform. So as part of the healthcare team, when we see that kids are out of school, the parents are calling them ill, calling them out of school ill, we follow up with those families to see how could we assist to break down some barriers, help them with some resources, you know, just making sure that they have what they need to keep them in school. So that's part of our role as a school nurse team, is to provide the families with that.
What do we think? What do we see? Have we seen a pattern? The most common reasons, for example, if children are not ill but they're not at school, what are some of the reasons that might happen, and how do we intervene and provide resources for those families?
Mm-hmm. Well, illness is a common one, and illness also related to allergies and specific allergies, for example, or other reasons could include asthma. Mm-hmm. So in some instances, we have students who have asthma, and they have varying degrees of asthma, where parents and guardians believe that keeping them home is the most effective way to treat the asthma. Now, that may very well be true, but there may be opportunities where the threshold is not so much where the student should be at home, but working together with our school nurses to really further assess and determine whether or not the illness requires the student to be at home is what we would want to work with the school site as well as the parent and guardians to determine.
Now, we talked a little bit before about, you know, just it's pretty obvious the importance of having students at school. It's pretty obvious the reason we'd want that. Obviously, for school district purposes, it's worth money to us, right? We receive funding based on, but there are a lot of other reasons. Can you expand a little bit on what are really some of the maybe not so obvious benefits of children being in school every day?
Some of the intrinsic value about school attendance is that it allows students to begin to form a sense of consistency and routine that will help them later on in life as they go out and seek jobs. Moreover, there are studies that indicate when students come to school and have a strong partner that they look up to, like a mentor, they're more likely to be in school and share mentor services as they age. So it helps prepare students to be part of the community, and it gives them a sense of belonging.
And I think that's really a good point. I've seen studies, or I've read studies in the past that show the attendance pattern, the attendance habit that children develop in kindergarten is the same attendance habit they're going to have 25 years later when they get their first job, or in their employment in life. That those patterns really begin early in helping kids develop a habit. Yes, this is your job. I mean, in addition, right? There's so much research that says show up at school, work harder, get smarter. That's just the way that it works. Just being there. 90% of success is just showing up. That you can't get smarter unless you're there. We talked a little bit about some of the organizations. So a couple I just want to delve into a little bit more. What's Tri-City Health's role in this? And why would the police department care so much about having kids in school? I think they're fascinating, right? The health folks and the police department. Can we talk a little bit about those two partners in Everyday Counts campaign?
I can talk a little bit about Tri-City Health. We partner with that organization because they provide a lot of resources for our families, the new families that come into our community that come from out of town or from out of country or whatever, to provide medical care for our families and for our students. And that's who we tap into when we have students that are chronically ill. We go to Tri-City, we send them over to provide the resources if they have asthma or whatever it is that they're struggling with. Could be mental health as well. Glasses, dental work, any of those kind of things that could keep a child out of school. That's what Tri-City really Health is there for, is to provide that resource to keep the kiddos in school.
And then in terms of our partnership with the police department, when students are not in school and are truant, we're talking about a public safety issue. At the same time, the police department also understands the value of daily attendance, and not just wanting to make sure that kids are in the safest place that they should be, which is school, but also partnering as a community member and understanding that they also play a critical role in helping provide a positive learning experience by students attending school on a daily basis.
Now, Danielle, your specific role, what is it you do to help students have strong school attendance?
So as a child welfare and attendance specialist, when there are students of concern or they're exhibiting patterns of truancy, they'll be referred to Dr. Mariko or myself. And depending on the case, we first reach out to the family, just describe what you've noticed, and ask if there's anything going on with which we can assist them to make sure that their student is in school, and just be very consistent with that family and reach out until we have we've found a resolution. And
I think the point you're making is a really good one. Oftentimes, particularly with young children, there's something happening in the family, or the family needs help with something, and that's the reason. See, I picture the big 6-foot guy with the big mustache and picking kids up by the scruff of the neck, saying, "Oh, truant officer," but it really is, I think, so much more than that. It's providing support, figuring out something's happening with this child because the family needs help. So it's stressing the importance of school attendance, and sometimes, oftentimes, it's getting the message to the parents. It's related a little bit to this idea of tardiness for school, because, you know, we talked about the importance of being there, but we haven't focused as much on the number of students in our district who are tardy for school and why that happens. Can we talk a little bit about that?
Well, that's data we are collecting right now. Right now, specifically what we're experiencing in our district because of many schools being overcrowded is students being shuffled from one school to another. So we want to be able to further collect data to understand the impact of that. So more information to come on that piece. Fremont, a simple 5 to 10 mile drive during rush hour traffic can cause some hardships for families, especially when they're shuttling multiple children to multiple schools. And there are, we do understand that, and sites work with us, and we work with sites to try to get a better understanding on those barriers. And we don't just stop at just identifying the barriers and just allowing the tardiness to persist without effectively trying to problem solve that with families, and then working with families as opposed to attempting to promote policies or enforce things to them or for them.
Well, I think it's really interesting. You're right. Oftentimes when children are late to school, especially elementary school children, it's a responsibility that falls on the parent, because the parents haven't quite organized their life. And I'm not blaming anybody. I've been there as a parent. You got to organize your life so you can get your kids to school on time. But I think it's important to also recognize part of that issue in our schools is because of the overcrowding. You're right. We're shipping folks long distances from one school to another simply to provide space for them. I notice we're all sporting these everyday count bracelets.
Yes.
Which is a proud thing. How else are we getting the message out to the community?
I'll take that one if I may. So back in the month of May, we had the Ohana Health Fair, where we partnered with Tri-City Health Center to promote a soft launch of Everyday Counts, and we handed out attendance materials and spoke with several hundred families from our district. And then upcoming, we have a City of Fremont proclamation by the mayor announcing the National Attendance Awareness Month, as well as Everyday Counts. And ongoing, we're collaborating with the School Resource Officer Division to canvass the community and create awareness with small businesses and areas that maybe older truant students might congregate during the school day.
Well, that's awesome. And tell me a little bit about the banners and the posters that are we're seeing around town.
Each one at the school was given a banner to post out in front of their office or wherever they opt to put it, so that the families, when they come by and they drop off their kids, they can see what we have going and they can ask questions about it. AC Transit, the bus stops have got posters as well there and in different languages, so that anybody that goes by or rides the buses or whatever can see that Fremont does care about what's going on with their students. And you know, that's what we're promoting, is to make sure all of the kids are in school. Each one of the entities, the City of Fremont, the police department, as well as Tri-City Health, they've got the banners in their offices, and they're talking about it with the families, especially with the healthcare, to make sure that the kids, you know, get to and from the doctors and then get back to school, you know, as soon as they can. So each one of these entities knows it's important for our kids to be in school, and then anything that they miss, there'll be a lack there, there'll be a gap. So we want to prevent that gap and just make sure that the kids are in school every day.
And I think it's important also, you know, it's not just students, but it's also sharing that message with the adults at school. How important, not just the students are there every day, the staff is there every day. The more we have that consistent environment, I think it's really a powerful strategy to getting to high levels of achievement for all kids. Absolutely. Students need to be there. The adults need to be there. I always share, I try to set the example, 36 years, 1 day of absence in 36 years, and I blame it on my wife because she had a baby on that day. But I think the importance of just having that consistency and really setting the example. And I think parents play a huge role in that of and good health and being healthy really helps when you just are fortunate enough that you don't get sick. Or if you do, you take care of it. I know we're early in the school year, but have we gotten any feedback on this campaign or heard any reports of how the message is getting out there?
And you're right, it is early. However, we have received some feedback already. There are folks that have expressed to us, they see the banners, they see the everyday counts on the transit shelters. When they see everyday counts, they associate everyday counts and the motto, the slogan with daily attendance. And it's what we've also heard is that there's people also noticing the banners and noticing the partnership that this includes, not just the district, but also our community partners out there.
If parents or families need more information about school attendance, want resources, I know we often, for example, will hear from parents about particular struggles they may be having. Oh, my child is really hard to wake up in the morning, or those. If a family just needs help with those kinds of issues, where should they go? Where can they start?
So there are 3 websites that I would refer folks to. On the local level, you can go to our fremont.k12.ca.us website under Student Support Services, Attendance and Truancy. You can reach out to myself or Dr. Marenko with any questions on any topic on that page. The next level up at our county is the alcoda.org, alcoda.org. That's the Alameda County District Attorney. And that website has a lot of really great multilingual parent resources, flyers, tips, references to certain ed code. And then nationally, there's a website called attendanceworks.org, which has additional videos, different campaigns that have gone on across the country to promote school attendance.
If I were a parent, before I went to those resources, are there folks at the school site who might be able to help me in addition to online resources? I mean, I just need to talk to somebody about this. Who should I go and talk to? Well, you're right. You said they can call Student Support Services. Are there people at the school site who can help them?
Go ahead.
We've got the school nurses, which we talked about before, and also there are counselors at the school site, and even the principals have that information, the assistant principals. You can walk into the office and there's a lot of resources that will be there to assist. So,
and I want to also have us think about, we talked about from the very beginning, just showing up at school is important. It's important for student achievement. That's why, as a school district, we care so much about this. We often talk in our school district about the achievement gap and the fact that, yes, we are a great school district. Yes, we have very high attendance. But as Dr. Marenko told us in the beginning, 1,500 students don't have that excellent attendance. Yes. We also know in our district we have an achievement gap. We do a great job for students, but not every student is successful. What's the relationship we see between school attendance and the achievement gap, where we know in our school district we have very high achievement, but particularly in Fremont, African American and Hispanic students, the levels of achievement aren't as high as our Asian and white population. Do we see the same thing, same pattern in school attendance?
Dr. Morris, we are seeing a similar pattern with the attendance. So when we look at our subgroups, we are seeing students with many layers. Students, for example, students in transition, some of our small percentage of foster youth students, students who may be English language learners, students, again, who are coming from African American, Latino backgrounds. These are some of the populations that, yes, while we are seeing positive improvements in attendance, we still have subgroups that are currently also exhibiting challenges with coming to school, which again then translates to some challenges that they could potentially have academically.
And I think your going back to what Ms. Knight said in the beginning, oftentimes it's really finding out the reason, figuring out what's going on, and then providing support for that family will really help us get to everyday counts, every child, every day, every classroom, every school across Fremont. Anybody need to get the last word in?
One item that we were proactive this year compared to others is with our new student information system now going on our 3rd year, we are understanding more and more of what it's capable of doing. So working with our IT department, we were able to be more proactive about providing our school sites the list of their chronically absent students. So it's one thing to share with school sites, these are the percentage of your school that's chronically absent, but it's another to attach names and subgroups so that now as a school community we can partner with school sites to be more proactive as opposed to waiting 6 or 8 weeks down the line when attendance does start to manifest itself as negative. We are now being more proactive so we can establish those partnerships early on in the academic school year.
And I think it's so important, you're right, because then the schools are able to share that data with parents. And just in my experience, oftentimes you'll say to a parent, hey, your child's been absent, 7 days, so my child hasn't been, here are the dates.
Right.
Wow, I didn't realize. So you're right. Oftentimes the first step is making sure that parents, teachers, school administrators, and the healthcare professionals, the nurses at the school, have the information. Who are these kids we should be looking at or seeing if there's ways that we can help them? Well, I appreciate very, very much all 3 of you for your expertise, for your passion, and for your excitement about making sure that our students are in school every day and learning. So for all of us at Community Conversations, we thank you and we look forward to everyone in the Fremont community helping us to get the message out that every day counts.